Myofunctional therapy is the study of the tongue muscle and the surrounding facial muscles. So we concentrate and work with people with a series of exercises that help correct the tongue posture.
Most people don't know, which I didn't know several years ago, was that the tongue is the best expander. It's part of your body, and when you swallow, you express an expansion force, not just to make room for the teeth, but it grows the midface and the lower jaw forward. And so when we work with other healthcare practitioners, it's important that we let families know that the ultimate correction is to correct posture and function.
If the tongue is not in the correct posture, then people have a harder time nasal breathing, and they are more apt to mouth breathe. And we would prefer nasal breathing and learning to breathe correctly with our diaphragm versus just our lungs. And then we also work to make sure people aren't having issues where they're clenching or grinding, that their muscles are not contracting all the time. We also look to make sure people are chewing correctly and swallowing correctly. If they're not chewing their foods bilaterally on both sides of the mouth, then they have more of a risk of overcompensating by developing one side of the muscles versus the other side of the face, which can therefore throw off somebody's symmetry or the balance of their facial appearance.
I always tell patients that on the first part of your life, as a child, if you don't use it, it won't develop properly. But as an adult, if you don't use it, you lose it. So for example, we've trained adults how to breathe properly, and we see a reduction in their congestion in their sinuses, which helps them to sleep better in terms, reduces inflammation, and they will also report significant health benefits. And we learned over the years that it goes well beyond jaw positioning. It's diet and exercise, it's function, it's nasal breathing, it is exercises to firm up the oral pharyngeal muscles so that they can maintain their airway patent. It is sleep hygiene. It is technology. It's learning to sleep position on the side and elevated. Whether you're a child or an adult, those topics never go away. They're always important topics that if we want to not just live a long life, but have good morbidity, good quality of life, that we have to pay attention to all those things too. For us, it's important to do those same things so that we age gracefully, that we maintain the best version of ourselves in our golden years.